Permanent Secretary in the Ministry of Home Affairs and Information, Ms. Yvette Goddard, and representatives from the Ministry of Home Affairs and Information. Chairman of the National Council on Substance Abuse, the Board of Directors, Mr. Hadford Howell, and respective members of the board. Manager of the National Council on Substance Abuse, Mrs. Betty Hunt. Deputy Manager of the NCSA, Mr. Troy Wickham. Research and Information Officer and report presenter of the Barbados Drug Information Network 2022 report, Mrs. Laura Foster. Presenter, Pharmacist 2 from the Barbados Drug Service, Mrs. Julie Williams. Representatives from contributing agencies to the Barbados to the Barbados Drug Information Network, joining us both in person and online. Representatives from the Psychiatric Hospital, the Substance Abuse Foundation, the Government Industrial Schools, the Financial Intelligence Unit, the Edna Nichols Center, the Center for Counseling Support Alternatives, CASA, the Barbados Prison Service, the Barbados Police Service, the Criminal Justice Research and Planning Unit, and of course, members of staff from the National Council on Substance Abuse, members of the media, ladies and gentlemen, good day to you. It is Drug Awareness Month 2024, and today we are happy to have you here for the release of the findings from the 2022 Barbados Drug Information Network report. And here to deliver the official welcome remarks is none other than our chairman, Mr. Hadford Howell. Mr. Howell.
I think this is for Paul of it, but I'll use it. Honourable Wilfred Abrams, MP, Minister of Home Affairs and Information, who, though not here, I must give him his due. Ms. Yvette Goddard, Permanent Secretary, and other members of the Ministry of Home Affairs and Information, Mrs. Betty Hunt and Mr. Troy Wickham, Manager and Deputy Manager of the National Council on Substance Abuse, Dr. Ronald Chase, Chair of the Projects and Finance Committee, and our other fellow directors of the NCSA, Mrs. Laura Foster, Bardin 2022 presenter, and other staff, members and volunteers of the NCSA, department heads or their representatives, Mrs. Julie Williams, representative of the Barbados Drug Service, specially invited guests, including those online, members of the media, ladies and gentlemen. A pleasant good afternoon to everyone. First, I'm delighted to welcome you to the NCSA and this presentation of the 2022 Barbados Drug Information Network report. We call it BARDIN. Today's activity is the penultimate activity for Drug Awareness Month 2024, which carried the theme NCSA Strengthening Prevention. During the month, NCSA undertook a wide variety of promotional activities, all geared to helping Barbadians avoid, or at least reduce, their inclination to move towards substance abuse substances. Second, we must thank Ms. Yvette Goddard, Permanent Secretary, for joining us. Your ongoing and unwavering support, ma'am, of and to the NCSA in this capacity, as well as being a member of our Board of Directors, is very much appreciated. and we believe this will continue. Team NCSA graciously permitted me a few minutes to make some brief remarks, and they will be brief. These will not be on the findings of this latest Barden report, except to say that I highly commend it to you, having reviewed it. Therefore, as hopefully a good driver, I shall stay in my lane and not drift into the lanes I anticipate P.S. Goddard and Mrs. Foster will venture into when they address you shortly. The NCSA Act, Cap 46, 1997, Section 4, lists 9 functions of the Council. One of these is D, which requires us to, and I quote, authorize, conduct, and facilitate research or surveys on substance abuse, end of quote. I understand this is NCSA's 11th, but I may be wrong on that. It may be the 13th, maybe I've miscounted, production of a Barden report since 2011. That means the NCSA is compliant with this specific function. Evidence-based reports of this nature are not simple or easy to organize, research, secure contributions from stakeholders before compilation to enable us to deliver and draw conclusions from any of our findings. This in turn then allows our minister and government to formulate appropriate amendments to existing policies or create new ones in order to push back on new developing trends identified in reports such as Barden. A team approach was essential and will continue to be. And this was again supported by committed interagency collaboration across the board, for which I publicly thank the respondents. Most of you would have heard our indomitable MC list a lot of the people who contributed to the report. So for that, I'm very grateful. I think in my memory, and I've been around here for a few years, it's the first time that I think I've seen all of the representatives, or most of them who contributed to the report, present at its release. So congratulations to you all. NCSA really thanks you for that. Give yourselves a clap. As I said, a team approach was essential. And this report was again supported by our board of directors, who were happy to give the guidance and support required. But I must therefore commend our research department for overcoming the usual challenges faced when seeking to compile such a report as this and deliver it in a timely manner. Post-COVID-19, NCSA's board of directors, management and staff remain committed to providing Barden reports annually and closer to the end of the year that has just passed. We've made that today. P.S. Your 2024 Drug Awareness Month message to the country on behalf of Minister Abrams, relayed during our church service on 14th January, encourage NCSA to be innovative in the drug fight and commit to utilizing an evidence-based approach to the creation of drug prevention programming. You also mandated us to, and I quote, conduct more local research on the drug phenomenon to ensure that we disseminate factual, timely information to all persons, especially our families, to equip them with the knowledge to make positive, healthy choices and increase productivity and economic prosperity. End of quote. I am happy today to report that the Council will continue to carry out both its legal function, along with your mandate, by drawing on the 6 pillars Minister Abrams should like us to develop and build out around families. In conclusion, I say welcome again to one and all. The Barden Report's 2022's findings provide much food for thought. NC is here to help Barbadians. I therefore urge those who see or hear these remarks being made by our speakers today, to contact the NCSA to make use of our services at the first sign of a loved one, friend, or colleague you think may require assistance to help them desist from using abusive substances. Finally, the fun part, I wish NCSA's management and staff an enjoyable fun day on Friday. You all deserve it. I thank you.
Thank you for those stirring welcome remarks, Chairman Howell. We are certainly pleased to have you as our chairman, and you remain committed to the mandate of the NCSA. Although not able to join us in person today, we certainly have received the blessings of our minister, the Honourable Wilfred Abrams, Senior Counsel, Member of Parliament, and certainly the leadership of his ministry is always in great hands, as today he has designated our Permanent Secretary, Ms. Yvette Goddard, who will now deliver remarks on his behalf. Please welcome Permanent Secretary Goddard.
Just making sure that I don't fall off. Members of the Board of Management and staff of the National Council on Substance Abuse, heads of departments and representatives, specially invited guests, members of the media, ladies and gentlemen, a pleasant good afternoon to you all. It is with pleasure that I address you at this meeting of the Barbados Drug Information Network, BARDIN, convened to highlight the key findings from the 2022 BARDIN report. The theme for this year's Drug Awareness Month is NCSA Strengthening Prevention, making the inclusion of this event on the calendar of activities particularly fitting. BARDIN continues to be a critical tool in monitoring the national drug situation, providing essential information for an evidence-based approach to policy making and programming. This in turn contributes to the development of stronger and more effective initiatives. Data such as that provided by BARDIN strengthens our national response to the drug situation by allowing us to move away from designing and implementing approaches based on subjective perceptions. Instead, it empowers us to operate from a position where we actively identify problems and then develop tailored responses to address them. Key to this is the identification of consistent patterns as well as changes on the local drug scene, both of which are facilitated through BARDIN. Our ability to identify emerging trends allows us to stay ahead of the curve and be proactive rather than reactive in our efforts. Likewise, an awareness of unchanging patterns may suggest the need for us to consider new methods to long-standing issues. Since the publication of its first report in 2013, BARDIN has highlighted the persistent prevalence of traditional drugs such as marijuana, cocaine, and alcohol within our society. But more recently, it has pointed to the emergence of non-traditional substances, such as methamphetamine and ecstasy. These discoveries provided justification for the establishment of the island's early warning system. In 2019, the early warning system is yet another research initiative spearheaded by the National Council on Substance Abuse, which provides critical information for action by stakeholders in the demand reduction and supply control sectors. While BARDIN offers a longitudinal view of the drug situation, the early warning system draws attention to new and emerging drugs in Barbados, also referred to as new psychoactive substances, or NPS. Once the presence of such substances is confirmed by the Government Forensic Sciences Center, alerts are issued to the public and stakeholders to raise awareness and mitigate potential public health threats. I am proud to say that the early warning system is up and running, making it one of only 3 functioning early warning systems in the Caribbean. In 2023, we saw the issuing of 2 alerts, one for methamphetamine and the other for synthetic cannabinoids, both of which were found on our shores. While this information is useful, I believe that it is only the tip of the iceberg, and we need to know more. For this reason, I was pleased to learn that one of the recommendations we will hear about this afternoon involves research on NPS in Barbados, and that there is already a planned study in the works. Armed with findings of such studies, we can work towards updating our legislation, ensuring that these substances are captured within our Drug Abuse Prevention and Control Act and other pertinent laws. Those in the prevention field can design and implement appropriate drug education and prevention initiatives, while the day-to-day operations of those in the medical, drug treatment, and supply control sectors can also be guided accordingly. There is no doubt that the NCSA's research initiatives, such as BARDIN and the early warning system, are powerful tools within our national arsenal. The Council also conducts research on a broad range of drug-related topics. A mere 3 months ago, the NCSA released its study on the barriers to treatment for women in Barbados. And earlier in 2023, we learned about their workplace survey. Studies like these are key to a comprehensive understanding of the drug situation. In that vein, I publicly challenge the NCSA to conduct more research, as was mentioned by Mr. Howell. Look at the drug problem from different angles. But I also urge you to not let your long-standing successes like BARDIN and the early warning system fall by the wayside as you undertake these new endeavors. They have proven useful and will continue to do so. And to you, the stakeholders joining us today, both here and online, now that you understand the value of the findings about to be presented, I challenge you to identify at least one piece of data which you can use to guide you in what you do. And I urge you to partner with the NCSA where possible to make some, if not all, of the proposed recommendations a reality. That said, I wish you all a good and productive session and look forward to the presentation and discussions. Thank you.
Thank you for those most insightful remarks, Permanent Secretary Goddard. And certainly the NCSA, led by our manager, we will continue to accede to the challenge issued by the Minister and facilitate those aspects of our mandate as it relates to research. And today, the moment that we have all looked forward to is here. It is indeed a pleasure to now invite our colleague and the coordinator of the research report and today's presenter of the key findings from the BARDIN 2022 report, none other than our colleague, Research and Information Officer, Mrs. Laura Foster.
Good afternoon, everyone. Thank you, Paulavette. For today's presentation, I'm going to start by giving some background information to BARDIN, because I know that a lot of you are familiar with BARDIN, but I also look around the room and I see that there are some new faces, and I'm sure that I have some newcomers joining us online as well. So to make sure that we all start off on a good foot, I want everyone to be familiar with what BARDIN is. Then I will begin to move into the 2022 report, starting with a look at the agencies which contributed, and then I will touch on the data from the various sectors. And then the last set of data which I will present will be a trend analysis. Once I've done all of that, then I will wrap up by discussing the implications of the findings and providing some recommendations. So what exactly is BARDIN? So this is the national mechanism which is used to collect and disseminate information on the drug situation in Barbados. So we're talking about activities in our treatment sector, also what we do in prevention and what's done in law enforcement as well. And the NCSA is responsible for coordinating and managing BARDIN. We have been doing this from the inception. And BARDIN goes back quite a while. This is something that we have been pursuing since 2003. But in the early days, the NCSA faced quite a number of challenges, particularly surrounding data collection. So that led to a hiatus. But in 2011, we relaunched BARDIN, and then we would have published our first report in January of 2013, so 11 years ago, and that was based on 2011 data. So that means that this report is actually the 12th report. And that said, that actually makes us one of the oldest and most established drug information networks in the Caribbean. I think we're second only to Grenada. So that is quite a feat, right? That said, we do publish reports, as I said, each year, and they're for calendar years. So we cover January to December of each year. And also, one quick thing to note before we get further into the presentation is that our reports are based on secondary data. So I know sometimes there can be confusion as to what type of data is in BARDIN, especially for persons who aren't familiar. And BARDIN, as I said, is based on secondary data, which means that we use existing data. So things that our partner agencies are already collecting in their day-to-day operations, that is what we collate to produce our reports. Now, BARDIN has a number of key objectives, and these are to provide current epidemiological and other information on substance abuse, to identify trends in drug consumption and offences related to illicit drugs, to strengthen the capacity of Barbados to respond to changing drug use trends, to provide relevant information for the planning, evaluation, and management of drug control programs, and to regularly update this information. So, some pretty powerful objectives it has. Now, one of the most important features of BARDIN is our ability to manage and to identify trends. Okay, because since we are doing this on an annual basis, we can watch things as they go. We can identify patterns, we can see as things change. And that's really important. And for that reason, now that we are at our 12th report, we've now been able to monitor these trends over the past decade or so. And so that means we have a good idea about the drugs that are being used, the profile of our treatment seekers, the profile of our drug offenders, what drugs are being seized. We really have a pretty good idea of what's going on now. And as you would have heard both Chairman Howell as well as P.S. Goddard say, this type of information is what we use to guide us in an evidence-based approach. Gone are the days where we do things based on what we think or feel may be the problem. Now what we do is we use our research to help us truly identify what that issue is, and then we can craft interventions and initiatives which target those problems. Right? And then we can turn around and use the same research to determine if our initiatives are working. So that's really very important. Now, BARDIN also has a number of other benefits. It's not only about trend analysis. As you would have heard, it really is a team approach where we are involving our stakeholders, our contributing agencies, and that said, it provides that opportunity for information sharing as well as for interagency cooperation. It also gives those agencies who are working with us the opportunity for them to strengthen what they do, strengthen their data collection, strengthen their presentation and their analysis skills based on what they give to us. It creates the opportunities for us to have reliable and standardized data. And this is something we have worked very hard towards. In recent years, we have done standardized data collection forms to make sure everybody is submitting similar types of data. And that has really gone a long way in strengthening our trend analysis. BARDIN also allows us, of course, to have a better understanding of the drug situation. The more we monitor it, the more we know about it. And then, as a result, what it allows us to do is to create opportunities to have a cohesive response to the drug problem. Now, we know that Bardin can be used for that evidence-based approach, but it also has a number of other uses. So it can be used to support policy. It can also be used in academic research. So I've seen it used in journal articles and stuff like that. And also for international agencies. They come to us because they know our data is reliable. They know they can trust it. So up to this week, I've seen a request from the Inter-American Drug Abuse Control Commission for data, and we're going to use the Bardin data to satisfy that. So that really gives credence to what we do here at the NCSA where Bardin is concerned. So now we're starting to turn our focus to the 2022 report. And for this report, we had 10 contributing agencies, and I'm proud to say that these agencies are all of our active network members. From time to time, you will have an active network member that's not able to contribute to a particular report, but this year, all of our members contributed. So I'm really happy about that. And as always, our report is divided into two broad sections. We've got our demand reduction, which covers what we do in prevention, as well as our treatment partners. And then there is the supply control sector, which looks more at law enforcement. Within the prevention and treatment section, you're going to find data from us at the NCSA, the Edna Nichols Center, the Psychiatric Hospital, the Substance Abuse Foundation, and the Center for Counseling Addiction Support Alternatives. In terms of supply control, there is data from the Barbados Police Service, the Barbados Prison Service, the Government Industrial School, the Criminal Justice Research and Planning Unit, and the Financial Intelligence Unit. Now, one quick note before we look at this data. When we met last year, the same kind of time, when I was presenting the data from the 2021 report, I would have mentioned the impact which COVID had on the operations of our partner agencies, and as a result, the reach that they had during the pandemic, specifically in 2021. And what we would have seen at that time was that they had had a sharp reduction in the number of persons that were reached by agencies in the treatment sector, as well as by us in the prevention division. And what we saw now when we came to look at the 2022 data is slightly different. There's been some measure of recovery. We would have seen in 2022 the relaxation and then eventual removal of the public health restrictions which were used to curb the spread of the virus. And that move back to normal operations is reflected in what you're going to see today. And we'll get to that when we get to the trend section, but I just want you to be on the lookout for it. We're by no means back to where we were, but we're on our way, okay? Also, something to note here is that we again are missing data from the Inmate Drug Rehabilitation and Counseling Program at the prison in the 2022 report. And that is because while the outside world returned to normal, they continue to have public health restrictions within the prison setting because they wanted to continue to curb the spread of the virus there, so the program was not in operation in 2022. But I believe they're starting to get back up and running now, so hopefully for our next report, we should start to see some of that data coming back in. Now, I'm about to begin the data. As always, I'm going to start with the demand reduction section, and specifically us here at the NCSA. So, as you all know, the NCSA is the agency that has lead responsibility for drug prevention education in Barbados. So for that reason, you will find that we do a number of interventions at the school level. We also go into the communities, and we also have a very active counseling program. And this chart here shows us the distribution of persons who would have participated in our interventions in 2022. And what you can see here is that the secondary school interventions had the greatest reach, followed by the community interventions and the primary school interventions. There also was a very small number of interventions which were conducted at the tertiary school education level. And then you can also see our counseling program, which accounted for 2% of the persons reached by the NCSA. But I want to caution you how you interpret that counseling data. And it's not that we don't do what we can. We very much are doing all that we can with what we have in terms of resources for the counseling. And really and truthfully, it's a reflection of the nature of the program. So this is a program where individual clients are treated by individual counselors. Our counselors aren't necessarily doing family sessions or group sessions where you have many persons being serviced in a session. It's this one-on-one. So naturally you're going to have this small percentage as opposed to, let's say, our drug education where we go out and we do groups and so on. So always remember that when you look at the data, it's the nature of the program. Also of note is the fact that we really saw persons across the age range participating in our programs in 2022, from ages 5 and up in this particular year. So we really had a wide range of persons participating. Turning now to the Ed and Nichols Center. For those of you who don't know, the center provides rehabilitative programming for secondary school students who have been suspended, referred or expelled from school, and they can go to the center for a maximum of 2 weeks at any given time. Now, students on admission to the center are tested for both marijuana and cocaine use, and in 2022 there were 85 students who were admitted to the center. And of those 85, 36 tested positive for marijuana use or were found to have trace amounts of the drug within their systems. And most of those who tested positive were males between the ages of 14 and 15. As is typical, no students were found to test positive for cocaine use in 2022. Now we're getting to our treatment data. And I'm going to start with the profile of persons who were seeking treatment in 2022, specifically starting with the gender. And here you can see that males far outnumbered females going into treatment, and this is usual. We always find this year after year. In terms of age, persons seeking treatment tend to be mainly 40 and under. We do get some older persons, but the bulk tends to be our younger adults, okay? Now, while that may be so, you will find that there is some variation from center to center, and that depends a lot on the population which they cater to. So, for instance, at the NCSA, we have a very large adolescent population, so you're going to find that the bulk of our people are in the 20 and under age category. But if you look at the SAF, instead, they tend to cater to full adults because they target 18 and over, and most of their people are actually 21 and over who come, even though they will cater to those 18 and over. This slide here shows you the distribution of persons who are seeking treatment for single drug use versus the use of polydrugs, so which would be the use of multiple substances. And the persons going to the drug rehab unit at the psychiatric hospital as well as to CASA and NCIS, were primarily treated for the use of single drugs. But this was not the case at the Substance Abuse Foundation. Their clients were more commonly seeking treatment for the use of multiple substances. Now, all drug users, even those who use multiple substances, will have a primary drug of choice. And this slide shows you the primary drugs for which persons were seeking treatment during the year. And what you can see here is that marijuana, alcohol, and crack cocaine were the front runners. We do see that there were a small number of persons seeking treatment for cocaine powder as well as tobacco use, but primarily it's those main three that are motivating the need for treatment in Barbados. Now, the literature shows us that mental health issues or mental health illnesses commonly co-occur with substance use disorders. This is a well-known fact. So it's not surprising to see that just over 1/4 of those persons who were admitted to the psychiatric hospital in 2022 had both a mental illness and a substance use disorder. And this has implications for treatment delivery. So now we're going to look at the supply reduction sector, and we're going to start with the Barbados Police Service. And this slide shows us that of the 5,803 persons, or cases rather, that were recorded by the police service during the year, 21%, so just about 1 out of every 5 cases were drug related. And much like who we saw going into treatment, our drug offenders were also primarily male and persons between the ages of 20 and 39. So again, that under 40 age group. The graph on your right, which is the age graph, that also shows us that as age increased, there was a steady decrease in the number of persons who were charged for drug offenses. So again, this underscores the fact that our young to middle adult population tend to be more likely to be drug offenders than persons who are older. When I analyze the data, I also always like to look at the distribution of offenses across drug type. And what we can see here is that 9 out of every 10 offenses on record for the year were cannabis related. There were a small number of cocaine offenses and also an even smaller number of methamphetamine and ecstasy related offenses. And while those methamphetamine and ecstasy cases are very small in number, they're still important. Because what they're showing us is that these substances are present on islands. So it doesn't matter how small that percentage is, it is still there. Now, in terms of the distribution of offenses within a drug type, what you can see here is a comparison of the possession offenses against all others. And that is because the possession offenses tend to be the single most common type of offense in each drug type. So I wanted you to see that pulled out by itself. And the reason that tends to be the single most common offense is because possession is typically a predicate offense. So that means that it is commonly associated or it commonly accompanies other more serious crimes as well. So that will be an additional charge that persons get. In terms of drug seizures, marijuana was the most commonly seized substance, and it was seized in many different types of forms. It was seized in compressed form, plant form, even loose form, and there were some seizures of stalks and seeds as well. In addition to marijuana seizures, there were a small number of seizures involving cocaine and ecstasy, also one seizure of hashish. And again, I point out those ecstasy seizures, small, but still present. So we have to keep monitoring that. At the prison service, we see that 1 out of every 10 persons who were incarcerated during the year were incarcerated for drug-related offenses. And again, much like our police data and our treatment data, they tend to be mainly males and persons under the age of 40. And here again we see drug possession far outnumbering all others. That was the most common offense for which persons were incarcerated. Drug importation was a distant second. There were also a few cases of incarceration for things like drug trafficking, possession of drug apparatus, and drug cultivation. Each year, the Criminal Justice Research and Planning Unit submits the sentence outcomes for persons who were tried for drug-related offenses in the law courts. And in 2022, as we've seen in previous years, most of the cases tried were cannabis-related. So by now you should be seeing some kind of a trend. Okay, a lot of cannabis being involved not only at the treatment, but also in the supply control sector as well. Across the chart, you've noticed that there are also cases involving cocaine, methamphetamine, and sometimes a combination. Now, I want you to look at the second to last column there, and you see cannabis and heroin. So again, this is at least one case. It's 0.3%, so that's looking like maybe one case to me. And what is interesting here is that never before have we seen heroin in our Barden statistics. So this was quite eye-opening, and it's something worth noting. Now, I'm going to actually present some of the sentence outcomes for you. And so as not to make this slide and this one that follows too cumbersome, what I've done is to pull out the top 3 sentence outcomes for the top 3 offenses within each drug type. And I'm starting here with cannabis and cocaine. And you can note from the little note on the side that what is included here, these 3 offenses in each case accounted for more than 2/3 of the offenses within each drug type. Okay, so you're looking at about 66% across these 2 drugs for each of them. Now, for both cannabis and cocaine, possession, trafficking, and intent to supply were the three most common offences. And the possession and intent to supply cases, they were most often resulting in persons being reprimanded and discharged, while convicted, reprimanded, and discharged was the single most common result for the trafficking cases. Now, with regards to methamphetamine, only possession cases were tried during this year. There were 3 of these. 2 were ultimately dismissed or withdrawn, while the remaining case resulted in the accused being fined. For the heroin case, so again, it was one individual who was tried, and he was tried or she was tried for both possession and trafficking. And they received a fine for the trafficking charge, and they were reprimanded and discharged on the possession charge. There were also a small number of cases involving unspecified controlled substances, and these all involved possession, trafficking, and importation. Most of them were dismissed or withdrawn. However, one person received a CRD for their possession charge, while the remaining individual was found not guilty. Let us now consider the adolescent population, which was in conflict with the law in 2022. Now, between January 1st and December 31st of that year, 53 wards were committed to the government industrial school, and 2 of these were committed for the possession of a controlled substance. And in each case, that substance was marijuana. Interestingly, both of the wards who were charged with this offense were 15-year-old males. Now, on occasion, the magistrate presiding over a ward's case will request that they be drug tested. And in 2022, only one ward, a 15-year-old male, tested positive for marijuana use, and no wards tested positive for cocaine use. And that number varies from year to year. So some years you'll see 3 being testing positive and so on, but this year we only had 1. Now, the last set of data from 2022 that we're going to consider this evening is from the Financial Intelligence Unit. And each year they submit their suspicious transaction report stats or data on their SDRs. And SDRs, or suspicious transaction reports, as the name suggests, are reports of suspicious financial activity which are submitted to the FIU by financial institutions as well as non-financial delegates, so people like accountants and those sorts of things. Now, the SDRs which the FIU deemed to be credible are sent on to the police for investigation. So always remember that an SDR does not necessarily equal a charge or anything like that, or doesn't necessarily equal an ultimate case. They're just simply building blocks for investigations, okay? Now, we are interested in these SDRs because of the strong link between money laundering and the drug trade. Now, that said, 7 of the 233 SDRs which were received during the year were drug-related. So that equates to about 3%, and sounds pretty insignificant, right? But really and truthfully, we also need to be concerned with the SDRs for which a predicate offense could not be easily identified, because these may later, upon police investigation, turn out to be drug-related. So we need to look at those as well. And there was quite a large number of these during that year, almost 3/4, 72.5%. So that is something to keep an eye on. Now, as I mentioned earlier, our ability to analyze trends is really one of the biggest advantages of Barden. So it really would be remiss of me if I came up here and I just presented 2022 data and I left. I really need to share with you some of what we've been seeing. I'm going to try for the most part to present 5-year data, but in some cases you're only going to see 3- and 4-year comparisons, and that sometimes has to do with differences in data collection as things have changed over the years. Sometimes even as persons have joined the network, they've joined at different times, so we don't necessarily have as much data for certain agencies. So you will see a little change as we go. Now, again, we're going to start at the NCSA. And this chart here shows us the number of persons who participated in our interventions between 2018 and 2022. And what we can see is that as soon as we hit 2020, there's a massive drop-off. And what happened then? COVID hit us in 2020, right? We again saw a reduction in 2021. So again, remember, we have all of these public health restrictions in place. You've got online schooling, those sorts of things, which certainly hindered our ability to schedule and get in and so on. We did, of course, put some of our stuff online, and we tried our best, but sometimes there are just certain things that are beyond our control, and we saw a drop-off. But here's 2022, and we're starting to slowly climb back up. We're certainly not back where we were, but it's encouraging because we're starting to see the turn now. This slide shows us the distribution of our interventions by intervention type over that same 5-year period. Now, traditionally, our primary school program had the greatest reach, okay? So that's where we would have had our most participants. And you can see that borne out in 2018, 2019, and even 2020. Because remember, COVID didn't really truly hit us until March. So that beginning part of the year, we were still, for the most part, operating normally. So again, we have that bulk being in the primary school. In 2021, a very different picture. It was mainly our community programs because, again, we were having all the difficulties with the schools, with online schooling and so on. So you saw that change. But by the time we get to 2022, and also at the same time in 2021, it wasn't only the primary school program that was affected, it was also the secondary school program. But by the time we get to 2022 and we're returning to normal functioning, back to in-person school, we see our secondary school program grow exponentially. But our primary school program, again, remained low. So we start to say, well, what happened there? And when we look at our data, what we know is that in 2020, we decommissioned our Life Education Center. Now, for those of you who don't know, our Life Education Center was our mobile classroom. We used this unit to go across Barbados to reach all of our primary school children. And that's where the most of our participants from all of our programs, that's where they came from the LEC. Now, it was quite an old unit. We'd had it for a long time. And we started to have some maintenance problems. We also were operating it under franchise from LEC UK. And because we were under franchise agreement, they didn't want us to make any changes to the program. So we couldn't make it current, we couldn't make it respond to the needs of our population today. So between the maintenance challenges and our inability to adjust the program as we needed to, the decision was ultimately taken to decommission the LEC and bring that program to a close. And then the unit was ultimately sold in 2022. So that will explain why our primary school program has remained low. Not to say that work hasn't been going on in the background, because in an attempt to meet that shortfall now, a suite of online educational materials has been designed. So our officer who was responsible for primary school, that's what she was working diligently on during that time. And those programs are meant to be used in conjunction with face-to-face interventions as well going forward. So work has been going on so that we can plug that gap. Now, in terms of the Edna Nichols Center, you see something very similar here, where you have that big fall off in admissions coming right with COVID at 2020, and again, a further reduction in 2021. And we're starting to bounce back in 2022. We're by no means back to where we were, but we're climbing back up again. So again, that is encouraging. In terms of the students that were testing positive for marijuana use at the Edna Nichols Center between 2018 and 2022, typically prior to this, we would have seen that percentage hovering around 20. So you can see it there in 2018, 2019, where you had the 23, 21, and going back, it was always around that same percentage. But then with COVID and all the changes that took place, we saw that some of these percentages varied widely from the norm. Of particular note is that 45.5% that was recorded in 2021. Now, when we last met, I proposed that likely had to do with the very small number of students who went into the Edna Nichols Center in 2021. That year it was only 11 students, so you were calculating a percentage on a very small number. So hence why you could end up with something that is seemingly large, even though it may not necessarily be a reflection of a big problem. So again, something to monitor. Then we have 2022, and the percentage is starting to fall at the same time that admissions were starting to increase. So is that coincidental? I don't necessarily think so. I do think that the two are related. So as the numbers are going up, you will see the percentages likely to come down, but we need to monitor it to make sure this is really what's happening and it's not that suddenly we've got a big problem, right? But we'll watch that. But I think it has a lot to do with the remnants of COVID and what's going on. Now, on to treatment. The next few slides are what you're going to see are aggregate data from all of the treatment centers that reported in each of the years. And again, similar picture. As COVID came, the numbers started to go down. And in 2022, we've seen a bounce back. And we're actually almost in the treatment sector back to pre-COVID levels. So this particular sector actually had the greatest recovery, no pun intended. And so this is, again, something very, very encouraging. In terms of the treatment clients, while the numbers of admissions changed, the profile of the clients tended to remain the same. So again, it was primarily males and persons in the 40 and under age group across all of the years. And also, in addition to that whole age and gender profile, another key thing to note is that a large percentage of our persons are unemployed who are coming into treatment, as much as 50% in 2022. Now, the percentages here are based on the persons who are unemployed and looking for work. So people who are genuinely unemployed. It doesn't take into account the large number of secondary school students that we have coming to agencies like the NCSA or even going to CASA, because yes, they're still unemployed, but theirs would be unemployed student. So these are people who are genuinely unemployed. We also would have people who are unemployed because they're retired. That doesn't take that into account. And then, of course, you will have the percentage of persons who are employed as well. But I really wanted to point this out so that you can see that there is a large percentage of our treatment clientele that are unemployed, and this will follow on or lead into really something I'm going to talk about in a little bit. Now, given the legislative changes which we had surrounding marijuana in 2019 and 2020, I thought it would be interesting for us to see if there have been any changes in the percentage of persons who are being treated for marijuana use disorders. And between 2018 and 2022, the numbers have been pretty constant, hovering between 41.9% and 46.9%, barring that exception of 33.2 in 2020, which again could be an anomaly because of COVID and the treatment numbers and so on, what was going on. But nevertheless, what you can see here is it has relatively held constant, and also approximately 4 out of every 10 persons entering treatment are being treated for marijuana. So something to note, because again, I'm going to touch on this as we go further down. Now, switching gears to the supply control sector, we're going to first look at the profile of our drug offenders. And much like our treatment seekers, our drug offenders also tended to be, over the 5-year period, largely male and persons in the under 40 age category. The slide shows that drug offenders are most likely to be facing cannabis-related charges, as these accounted for between 8 and 9 out of every 10 drug offenses on record during the 5-year period. And this slide summarizes the distribution of cannabis offenses during the 5-year period. And I've collapsed it a bit. I've left possession, trafficking, and intent to supply as standalones for you. And then I collapsed all the others into one category called all other. And I did this because I wanted you to see that while possession has been and continues to be the single most common cannabis offense, it has been reducing since 2018, and then we see at 2019 it came down, and so on, 2020 further down, and on we go. And at the same time, trafficking and intent to supply have gone up. And this change is coinciding with those legislative changes, which suggests that we're seeing fewer simple possession charges being meted out. Okay, so what we're seeing is more likely at this point now, possession as part of a wider or a more serious offense. Now, this interpretation, so that the whole issue being related to the change in laws, is supported by this slide. Now, this shows us the number of cannabis possession cases which were adjudicated in the courts in 2019, 2021, and 2022. Data was not available for 2020. So last time we met, all I could share with you was 2019 and 2021, but this time I've been able to add the 2022 to it. And you see that fall off between 2019 and 2021, and it still remains considerably lower. Yes, there was a slight increase in 2022, but again, it may be an artifact of COVID and the fact that maybe fewer cases were being tried. So now that we're back to normal functioning, caseload has gone back up for 2022. So we'll continue to watch that. But the main takeaway here is we've had a big reduction in the number of cases. So this is likely the result of that change, particularly the decriminalization of the possession of small amounts, okay? So that implementation of a fixed penalty. All right, so that brings me to the end of the data. So at this point now, I'm going to start to discuss some of the implications of these findings, and I will propose a number of recommendations as well. Now, one of the things that we saw in the trend section was the steady increase in the percentage of women who are seeking treatment. And this is really good news because women have traditionally faced a number of barriers which will keep them out of treatment or make it very difficult for them once they enter treatment to stay in and complete a program. So this trend may suggest that we're making some headway where these barriers are concerned. And the increased number of women seeking treatment means that there is the potential for positive outcomes at the individual level, as well as the family, and even the societal level. After all, women in recovery will likely experience physical and mental health improvements, which make them more likely to be productive members of society, and also more likely to better meet the challenges of parenting. And the latter is very important because a sober mother is more likely to be active in her children's lives, to serve as a positive role model, and to spend quality time with her children. She's also more likely to provide a comparatively safer environment for her child to grow up in. And all of these things bode well for the developing child and their future. But while we're seeing that increase in women, we should not get complacent, because the reality is there still is a very large disparity between the number of men and women entering treatment. So that tells us that there's still a lot of work to be done. And in this regard, treatment access and program content as well as program structure should be considered. For the latter, we need to consider developing and implementing gender-responsive programs which address the needs of women. And a really good place to start, and a good starting point, is the Treatment Improvement Protocol number 51, developed by the Substance Abuse and Mental Health Administration, or SAMHSA, in the US. And this document outlines the key considerations for the treatment of women. But I will caution that it is an international document, so it was never designed necessarily for our context. It has useful information, but for that reason, I suggest that we buttress it with a local needs assessment so that we can make sure that anything that is developed here is culturally appropriate. In terms of access, we again need to focus on removing the barriers to treatment for women in Barbados. And the recommendations which were proffered in the Council's Barriers to Treatment study, which the PS spoke about, those can provide great direction for this. And they include things like offering childcare services for women who may have issues with childcare or fears about their children's safety when they go into treatment, interventions to reduce addiction stigma, particularly through education and specially designed campaigns, and even interventions designed to help women in recovery meet their basic needs. Those are just a few of them. But those are good examples. I'm really happy to see that the NCSA has started to tackle the issue of stigma with recent advertising as well as webinars which were designed for both the public and professionals working in the field, but more is needed. And of course, we also need to give attention to some of the other recommendations as well. So that said, I'm suggesting that the policy and programming recommendations set out in the Barriers to Treatment report be reviewed for consideration and implementation where possible. We also saw that unemployment is a dominant characteristic of persons seeking treatment in Barbados. And this is not unique to us. This is a characteristic that's seen the world over. But that's not necessarily mean that we should take comfort in it. It just means that we're following the trend. But nevertheless, it's still concerning because unemployment is a risk factor for substance use as well as for relapse. In fact, having a job can be a make or break factor for someone, and it can make the difference between long-term sobriety and a return to active use. And this is because having a job provides key building blocks for recovery. It helps to alleviate financial insecurity, giving persons the ability to meet their basic needs, have food, have housing, and those are certainly critical for treatment success. Also, having a job has been found to provide structure in day-to-day living. It can help with your mood and with your self-esteem, and all of these have been shown to be buffers against relapse. So, to give a real-life example, when I was collecting data for the Barriers to Treatment study and I was interviewing one of the treatment providers, she spoke about 2 clients that she had had who had never done well in treatment. They had been in and out and they weren't successful. And then everything changed when they got jobs. And she said for her, at that point when they started to excel in treatment and to do well, she attributed it to them finally having a purpose. Having a job gave them something to get up for in the morning, something to do, along with all the other benefits like the structure and so on that comes with employment. So that's just to show you how important having a job is in terms of recovery. So that said, I'm recommending that efforts be made to reduce the unemployment among persons in recovery, and that a multifaceted approach to this be used. So this should include the provision of job training and opportunities for education and skill development as part of treatment and aftercare programs. I know this is done by at least one facility on island, but I'm recommended that it be expanded to the others. Treatment facilities can also partner with corporate Barbados to facilitate employment, internship, and apprenticeship opportunities for their clients. And the reality is that these 2 things can only go so far. So for that reason, there are a number of national initiatives which we also need to consider. So the first one is establishing a national employment assistance program which is specifically for persons in recovery. And I envision this being operated under a public-private partnership. So with the Ministry of Labor and let's say the Barbados Chamber of Commerce and Industry. And this particular program can have responsibilities like recruiting companies to participate, providing educational sessions for employers so they know what it means, what are the issues that surround employing persons in recovery, helping the companies to become recovery friendly. So this will also include developing recovery-ready workplace policies and facilitating job placements, just to name a few. There also remains a critical need for workplace drug policies in Barbados. Workplace drug policies enable organizations to respond to the issue of drug use in the workplace, as well as to assist employees who have an issue with drug use or who have substance use disorders. They set out the protocols to be followed. They also lay out what help is available and how it can be accessed. And the absence of workplace drug policies has been identified more than once as a critical barrier to treatment in Barbados, because without these protocols, employees often fear the future of their employment. What happens if my boss finds out that I use drugs? What happens if my colleagues find out? So they're hesitant to come forward to get help. So, again, drawing on one of the recommendations made in the Barriers to Treatment study, I'm again calling for a national campaign to promote workplace drug policies. I'm recommending that this have an education component as well, one that will set out what these policies are, the advantages of them, let persons know what is included in them, and not just for workplaces, but for Joe Public as well, so everyone can understand. And also, I again reiterate the call for NCSA to lead the charge where this is concerned, because we have that experience. We've been working with workplaces who are trying to get ahead of the curve and implement policies in their organizations. So we have a bit of experience. So I'm suggesting that we be the ones to lead that. Now, Much of what you saw today confirmed that marijuana continues to dominate the local drug scene, both in treatment as well as the supply control sector, despite the slow emergence of these new substances. And this is something that we've been seeing since the publication of our first Bardin report in 2013. So 11 years later, we're still seeing the same picture. So this supports that old adage that the more things change, the more they stay the same. Now, before the 2019 and 2020 legislative changes, there was a zero-tolerance approach where marijuana was concerned. But the legal changes, together with growing societal acceptance, reducing perception of harm, and the ease of access, all suggest that we need to do something different. The time has come. And this is where harm reduction can come in. So as the name suggests, harm reduction involves the reduction of harms, be they physical, legal, any kind of harm, which is associated with the use of a drug or drugs. Now, for the most part, while it can tackle various types of harm, the focus tends to be a lot on physical harm, so harm to health and so on. And the idea is to save lives and to protect not only the persons who use drugs, but also those around them as well as the wider society, and at the same time, destigmatizing addiction. So what it does is it shifts the focus away from that belief that drug use is a moral failing. And what it does is it shifts the view to the consequences of drug use. Now, harm reduction approaches come in different shapes and sizes because every potential harm provides us with an avenue for a harm reduction intervention. It simply depends on what you want to focus on. So, for example, you may want to address marijuana-related motor vehicle accidents, other marijuana accidents, marijuana dependence, mental illnesses that are exacerbated or induced by marijuana use, risky sexual behavior associated with marijuana use, or even the respiratory effects associated with marijuana use. It really is up to you what you choose to address. That said, examples of possible harm reduction approaches that may be useful in our context include implementing legislation that makes it illegal to drive while under the influence of marijuana, implementing roadside testing in cases where there is a suspicion of marijuana-impaired driving, educating the public about the dangers associated with marijuana-impaired driving, promoting the use of designated driver programs like those advocated for alcohol use, promoting the use of screening and brief interventions by medical professionals who suspect that a patient may have a cannabis use disorder or be at risk for developing one, educating the public about the possibility of dependence and the implications for mental illness with a special focus on populations most at risk. So we're talking about persons who are known to be frequent users, persons who may have a personal history of mental illness or who have a family history of mental illness. And also you may want to address educating the public about the benefits and risks associated with the various methods of marijuana administration. Now, a harm reduction approach can also be buttressed by the simultaneous use of what we call protective strategies. And these are behaviors that individuals can use to limit potential negative consequences if they opt to engage in drug use. So for instance, they may actively choose to use less potent products. They may avoid marijuana use before going to work, going to school, before driving, before operating heavy machinery. They may avoid methods of use that lead to greater levels of intoxication. Or they may avoid the use of marijuana if they take prescription medication that can intensify its effects. So these are some of the things that we can consider. Now, while the use of harm reduction and protective strategies offer us new alternatives to address the continued dominance of marijuana, there's also a glaring need for research which may highlight more suitable options and may ultimately point us in a different direction. At the start of this evening session, you heard the term evidence-based programming, evidence-based interventions, and research is at the driving front of this type of approach. Currently, we do not know the precise prevalence of marijuana use among the general population in Barbados. Anecdotal data suggests that it is quite common, particularly among our young population, but we don't have that hard evidence to support this. Barbados's lone household survey was conducted almost 20 years ago. So it is far outdated, and it is no longer useful to our policymakers or our programmers. So the time has come. We need to know how much, who's using. We need to know those kinds of things. So for that reason, I'm recommending that a household survey be conducted in the near future so we can determine not only the prevalence of marijuana use, but also the use of other drugs. Right? And this type of evidence will support the crafting of relevant, up-to-date policies and programs. And these will help us to address not only marijuana use, but also to curb the scourge of drugs in general. There is also a need for us to assess the impact which the marijuana-related legislative changes have had. To date, no such research has been conducted. And this type of research is critical for future policy making and programming, as it can highlight the need for initiatives to address unintended or unexpected fallout which came about from the new laws. And the reality is that this is not going to be an easy undertaking, because no research was done before the implementation of the changes. So those comparisons are going to be very difficult to make. But we can use proxy data. So things that can be, stand-ins to fill those gaps, to allow us to still attempt to assess the key indicators. And Barden is going to be one of the tools that will be critical in this regard. Some of the important areas which should be assessed include the potency, frequency, and levels of marijuana use, as well as the rates of marijuana use disorders and marijuana-related offenses. Now, while marijuana is seemingly the kingpin on our local drug scene, we can't ignore the emergence of new substances. We also can't ignore the developments which took place in 2023. So as you would have heard, during 2023, we saw 2 early warning system alerts being issued, one for methamphetamine and one for synthetic cannabinoids. There were also unconfirmed reports of at least 1 fentanyl overdose in Barbados. So these substances are all drugs which have significant implications for our public health, because they can pose significant public health threats. Now that said, when we consider our local discoveries with similar discoveries across the Caribbean and the proliferation of MPS on the international market, it is clear we need to know the current state of new psychoactive substances in Barbados, and we need to know it urgently. This will be key to designing and implementing appropriate responses to address and combat the emergence of these substances. Some of the areas that we need to know about include the substances which are available and in use, how or where they are obtained, the populations most likely to use them, and the methods of use. Research will be key for us to gain this understanding. And as you would have heard alluded to earlier, there is currently a project that's in the planning stages. It is being funded by the Inter-American Drug Abuse Control Commission, or CCAD, and it's going to focus on the trafficking, sale, distribution, and use of MPS and other emerging drugs in 3 countries. So Barbados was lucky to be selected to be a part of this. It's going to be us, Jamaica, and Trinidad and Tobago. It will also review the country's current response to MPS and provide suggestions for improving these responses, as well as approaches to monitoring the substances going forward. And this study is slated to be conducted in the next couple of months. Now, this planned study is going to be using a qualitative approach with a heavy reliance on interviews. So we're going to be going to key informants, people who have inside knowledge, be it professionals, potential users. We're really going to look at this using a well-rounded approach. But I'm suggesting that we also buttress it with the conduct of what they call a wastewater analysis. So this particular type of study tests the wastewaters of a country to estimate community use of certain drugs. And it does this by testing the waters for drugs themselves as well as the metabolites of drugs, okay? Now, one common approach to studies of this nature is to conduct them at parties and festivals and so on, because the likelihood for drug use is higher in situations like these. So that being said, I'm recommending that the study be conducted during crop over. We go to the fetes and we test the wastewaters from the chemical toilets, okay? And that way we can have an idea of what substances are being used here in Barbados. Now, in order to make this study a reality, we're going to need the input and involvement of our Forensic Sciences Centre. We're also going to need the input and involvement of the Barbados National Standards Institution. So I'm also recommended that they do not just work with us to make the study happen in terms of the testing, but they also work with us to design it. So we look at it from all angles, and we consider the important intricacies where chemical analysis is concerned, because we don't have that background here at the NCSA. Now, in terms of finding out more about what drugs are being used, drug testing also offers us a more practical approach, so individual drug testing, and this can be used with populations that are more likely to try or to experiment with these types of substances. So our young people, and one easily accessible population will be those students who are going into the Edna Nichols Centre. They're already being drug tested, so this may be something we can consider. Also, our persons in treatment, we can look at that as well. Now, currently, some of these institutions, there's no standardization in terms of testing that's going on right now. So some of the institutions are only testing for things like marijuana, cocaine, in some cases alcohol. Others are doing a somewhat more expanded testing. So some agencies are testing for 7 drugs, others for 13. But if we can get some standardization taking place, and what will be needed here is the use of extended drug panels. And yes, these will be helpful in terms of finding out the use of non-traditional substances, but they will also be useful for the practitioner because they will give a more comprehensive drug use history of their clients, so they'll know what they're working with as well. So not just from a national data collecting standpoint, the benefits will be twofold. Now, that said, I think we need to target the agencies in order of importance. So those who are using smaller drug panels, let's target them first. Let's start to build out, right? And until we can get everybody on the same page using the most extended drug panels. And of course, we need to make sure to use the ones that will include the substances which are newer to our markets as well. So make sure to use the correct drug tests. Now, we've reached the end. I know I have shared a lot with you today. I've gave you a lot to think about. So I thought I would kind of wrap up with the main takeaways so that you leave with something fresh in your head since I talked about so much. And that said, I want you to remember that our 2022 drug situation was similar to that presented in each of the 11 preceding reports. So we saw alcohol, marijuana, and cocaine again being the most prevalent. We have the continued dominance of marijuana, which suggests the need for us to take a new approach to this old problem, and harm reduction and the use of protective strategies provide us with possible alternatives. Recent developments on our local drug scene point to the emergence of non-traditional substances, including new psychoactive substances, and therefore there is an urgent need for us to get information about the state of these substances in Barbados, and this can be satisfied through the appropriate research methods as well as drug testing. And there has been a steady increase in the percentage of women seeking treatment, but work still needs to be done. And we need to close that gender gap. And we can do this by focusing on treatment access as well as program content and structure. And lastly, unemployment is a key feature of persons seeking treatment, and it should be reduced through the use of a multifaceted approach, which involves initiatives at the micro, meso, and macro levels. Now, all of that said, I know you'll be happy to see me step off step away from the podium, but I thank you all for staying the course with me this evening, and I'm going to hand you back over to Ms. Atkinson.
I think that Ms. Foster deserves another round of applause. Those findings were extremely extensive, and I'm sure that it will provide much discussion in the coming weeks, especially based on those recommendations. And certainly one of the topics that was put forward was the understanding of new psychoactive substances in the local context. And that segments very perfectly into our very next presenter's presentation. And with us today, we have a noted pharmacist of 28 years experience. She is also, in addition to being a pharmacist one, she is drug information officer with the Barbados Drug Service, having responsibility for providing medical information to healthcare professionals and the general public, as well as maintaining and updating the online Barbados National Drug Formulary application. Without further ado, it is a pleasure to invite our colleague and presenter on the topic, Did You Know? Key Information About Fentanyl, none other than Mrs. Julie Williams.
Good afternoon, everyone. Did you know information about fentanyl? Today we're going to look at some key facts about fentanyl. Fentanyl is a powerful synthetic opioid that is similar to morphine, but is 50 to 100 times more potent or stronger than morphine. There are two types of fentanyl, the pharmaceutically produced fentanyl, and then there is the illegal produced fentanyl. The pharmaceutical fentanyl is usually made in a laboratory by scientists, and it has a similar chemical structure to morphine. And like most people would know, morphine is used to treat patients with severe pain, especially after surgery, or it can sometimes be used to treat palliative patients with chronic pain who are intolerant of the other opioids on the market. Fentanyl is a controlled substance. That means in our laws, in our drug laws, we have different schedules of drug. We put drugs in different schedules, and fentanyl is a Schedule 1 drug, meaning that it has the high incidence of abuse, and of course its strong nature and its most potent drug that we have on the market for pain. It is only prescribed by a physician, and it must be dispensed by a pharmacist. It is not an OTC product. You cannot pick it up on the shelf and take it at will. And it is highly regulated and monitored by the International Narcotic Control Board, which we, Barbados, are signatories to. It is stored in a narcotic cupboard. That's a special cupboard that only certain persons should have access to. And for every prescription that is dispensed, you have to indicate in this register who it is that was indicated, who prescribed it, where they live, telephone number, the full works. And also, it is not just imported by any and everybody. It must be imported. We give, at the Barbados Drug Service, we have some specific importers and exporters that can only import and export this drug. And we also give them authorization to do these things. Fentanyl comes in basically 4 types of formulations: patches, injections, lozenges, and sublingual tablets. Sublingual tablets are tablets that you either put inside your cheek or you put them underneath your tongue and they slowly dissolve. Here are some images of illegal fentanyl. As you can see, some of them look like sweeties. Some look like drugs that you would have in your medicine cabinet. But this drug is a very dangerous drug because it is made into powders, dropped on blotting paper, put in eye drops, nasal sprays, or made in preparations that look like other opioid drugs you have on the market. And what I've noticed in doing my research for this presentation is that some of these drug dealers use fentanyl and mix it with other drugs. So they mix it with heroin, they mix it with cocaine, methamphetamine, and other illegal drugs. This is because it only takes a small amount of fentanyl to do harm. And it only takes a small amount to produce the high. This is especially risky when patients take in drugs and do not realize that it contains fentanyl. Not only is fentanyl a highly addictive and dangerous drug, it has other implications as well. Like, for instance, I have here risk of exposure to first responders, customs officers, and police. Now, let's give a scenario where we have a substance came in either through the airport or seaport. You are not familiar with what it is. It's a little powder, white powder. It could be anything. And think, for example, picture a first responder, a police officer, or a customs officer touching that fentanyl. And then that's it. Because one single touch of the amount of, if that was fentanyl, let's say a container came in and it had in this little white powder and you touched it without any gloves or anything like that, or you inhaled it, or you touched it and then rubbed your eye. All of those are potential dangerous activities that can lead you to being exposed to fentanyl. And recently, I saw a case that is going on in the United States at the moment where a child, 2 years old, was, well, I don't want to say murdered, had died as a result of having come in contact with fentanyl. And that child just died. And up to now, they cannot figure out why that child died, how it became exposed to the fentanyl at the home. And of course, I have here at the bottom, it only takes 5 to 10 grains of fentanyl to cause death. Now, I want to look at some common signs of an overdose of fentanyl. We have strong constricted pinpoint pupils, falling asleep or losing consciousness, slow, weak, or no breathing at all, choking or gargling sounds, limp body, cold or clammy skin, and discolored skin, especially on the lips and nails. Now, to treat fentanyl, we have 2 drugs of choice. The first one is more popular to us here in Barbados, Narcan. It comes as a nasal spray, but it also comes in an injectable form. But the nasal spray is usually used because that's faster and quicker action than an injection. These medications help to temporarily reverse the opioid overdoses, but it can wear off quickly, and you may need additional doses of the same Narcan or OPV in order to reverse the effects of the fentanyl. The OPV has been recently approved, and it is also in the form of a nasal spray, and it is used as an emergency treatment for opioid overdose in persons aged 12 years and over. I hope this presentation was informative, and thank you so much.
Thank you, Mrs. Williams. And you have continued to embrace the theme of strengthening prevention, because I am sure that everyone present today has learned some new information, especially as it relates to fentanyl and its dangers. We will now revert to the question and answer session, coming from the presentation on the key findings from the Barding 2022 report. So the floor is now open to members in the audience as well as those online
to pose questions to Ms. Foster as it relates to the information and the data that was presented. I know she did an excellent job and was very thorough, and I must say that every year I look forward to her presentations because it provides persons who are not involved in the sector with a very clear and simple understanding of those key findings. So are there any questions from the audience or the media personnel who are joining us today? No questions posed from our online audience? I am not receiving any instructions to that effect. We do have a question. Could you come forward to the mic, please, so we can hear you clearly? Thank you so much.
Good afternoon. Sharia Brathwaite from Barbados today. I would just like you to expand on two things, Ms. Foster. I find it quite interesting the point you were making about the testing of the waste at different institutions, the clubs, etc. I never heard of that before. I would like you to expand some more on that. And also the point you were making about the drug policies at the workplace. I find that a little hard because I don't know who would want to admit that, they're using drugs at work, seeing that there's a stigma against it, and usually in the interview process, that's one of the questions, or that's one of the things that you talk about before you even actually get the job. So I don't know who might want to come forward and admit, yeah, I just use drugs.
Thank you for your questions.
Okay, so I'm just going to briefly touch on what you asked, and then I'm going to direct you to the key people who will be able to expand better for you. So just touching on the wastewater testing briefly. This is something that's growing in popularity. It's done in Latin America. They've been doing it in North America. So we will now be kind of bringing it to the region with a few studies here. And so they test the wastewaters specifically for all types of drugs to see if they find presence of the drugs or metabolites of the drugs in them. What I'm going to do is I'm going to ask Dr. Chase to speak to that. In terms of the drug policy, the whole thing where you said persons would be afraid to come forward, that's why those policies are so important, because it is clearly set out what can happen. You know what the position is with your employment, you know what help is there. So persons can take comfort in knowing that there are no uncertainties where that is concerned. So drug policies really are important. And what I'm going to do is I'm going to direct my manager to speak to that, because I know she has been closely involved with different organizations developing their policies. So she's excellent on that. So in order of how you ask them, Dr. Chase, if you want to come and speak to the wastewater, that would be really great.
A nice step. Wastewater testing is not new. It has been a technique used kind of as an adjunct to screening tool, as we would call it. So, as the name suggested, you test the waste from a particular area. So, for example, we mentioned in terms of at party events, but it can also be at certain sewage points as well for neighborhoods. So the samples are collected and then they're analyzed for the presence, and not just the presence, but the quantity of certain drugs or any drugs. Now, the reason why I think They usually do it during periods where there are likely to be drug use. It is not to falsify or to indicate anything. It is just for us to know what is on the ground, because during parties and during festivals, persons are more likely to use whatever they want to be in the right mood to party, right? But it's used, very useful tool. It allows us to know, okay, well, what are the drugs that are present in Barbados, and it can give you, based on the concentrations in the water and the sample you collected, because just not one sample, there's many samples on the average done, it will give you an indicator of how likely prevalent it is within the community. Honestly, the council will probably like to see it implemented as soon as possible, but everything has to be planned properly in order for the results to be meaningful, an actual reflection of what is happening on the ground, proper planning for that study. And we're actually engaging with external and regional partners in conducting that study. Yes. Yes.
Hi, I'm sorry. Hi, good afternoon. Katrina King from Loop News. Ms. Foster, during your presentation, you would have made mention to a first findings for the Barden report with regards to heroin use. Can you speak to heroin use in Barbados? Like, what is it currently? Because you mentioned about one case.
So in terms of what we would have seen in the data, it wasn't about use, it was to do with drug offense. So what you would have seen, let me just pull it back up very quickly, it was one individual who was being tried for possession. One second, I want to pull it back up. And will that come up from here? Where is it? Right here. Right, sorry. So it was with, there we go, for possession and trafficking. So it was not use per se, but in terms of, since you asked about use, again, I will defer to Dr. Chase, since he deals directly with clients in terms of drug treatment at the psychiatric hospital, so he may be able to give a better answer in that area.
If I recall correctly, with the 2021 Barden report, there was a client within one of the treatment centers who gave a history of prior heroin use, right, on the island. Now, there have been other clients who would have had a history of heroin use, but they would have indicated that when they were overseas. Now, there is maybe anecdotal evidence of heroin being used in Barbados, but it's anecdotal. So I can't give a prevalence of that at present. But this is where I would introduce something called a system that you would have heard about, I'm hoping, the early warning system, where the alerts came for the synthetic marijuana and from crystal meth. This is where the anecdotal evidence can be fed into that system, so that all of our stakeholders, all our partners, you sitting there, right, can feed into that warning system to say, okay, well, we're having these sightings, or we've heard this on the ground. And where does that and how is that important? Because once then that is heard enough, then we have grounds to go and investigate to really find how prevalent it is. But if no one is saying anything, then no one knows. But we did have this one in 2022, and priorly in 2021, someone stating that they had previously used it on the island.
So, good afternoon, and thank you so much for your query with respect to workplace drug policies and hesitancy of employees to undergo drug testing. The first thing we're reducing stigma is bringing it out in the open, bringing the issue out in the open, whatever that issue may be. We've seen that certainly with a lot of other issues. We can refer to how the whole issue of HIV/AIDS was managed, and certainly the fear that surrounded that. We saw it most recently with COVID and the fear that surrounded it, and then speaking about it and bringing it out in the open. We do believe that without a workplace drug policy in place, it will be to the detriment overall of our economic situation. We acknowledge, I think Laura mentioned it, that there's a growing acceptance now locally towards marijuana use, for instance. There are laws dealing with medical marijuana. So if I am prescribed that as an employee, there must be something in place to allow the legitimate use of that, but also recognize that there's something else that we don't speak about a lot, which is the abuse of prescription drugs. I'm sure Dr. Chase will speak to that. And so workplace drug policy is not necessarily to catch a drug user, but to set the parameters for persons, both the employees and the employer, which Laura quite rightly alluded to, so everybody is clear. What it also does is allow an employee to seek help, knowing that there's a progression and there are options open. I want to also caution that not only employees may use drugs. There's also a system in place for the employer, him or herself. And so that person has to be considered as well, because what happens when you as an employee is employed by somebody who is a drug user, who is impacted by problematic drug use. So there has to be a system in place, there has to be a balance in place, but you are right, there's still a fear and a stigma, and the only way that we can reduce that is having clear policies in place so that there's no discrimination, so that people do not feel that they're unfairly attacked in the workplace, and so that when they say, I need help, that help is provided along a continuum. And so that is what the NCSA is encouraging workplaces to adopt, workplace policies going forward. I hope I was able to answer your question. Thank you.
Thank you for responding so eloquently to those questions, Manager and Dr. Chase, respectively. And thank you to those who posed questions. We also have a comment which was proffered online from our counterpart, Dr. Alana Griffith, who indicated, fantastic presentation, truly delighted to hear the plans for surveillance during crop over and wastewater analysis. A colleague of Dr. Kirk Douglas from the Center for Biosecurity Studies has long been advocating for wastewater analysis for drugs, especially from airplanes and cruise ships to ascertain substances people entering the country, what they may also be using. So I do believe that that is also another perspective that must be taken into consideration. Thank you, Dr. Griffith, for that comment. Are there any other questions being posed? We have one other question. This is a question from a member of our online audience to everyone. and it states, I'm sorry, it's a comment. In respect of the police officers making contact with fentanyl, our officers in Barbados readily provided with Novocaine on duty. It was mentioned that I observed many videos in the US where officers literally came into contact and were saved by Novocaine administered by their colleagues. So the question is, in respect of the police officers making contact with fentanyl, our officers in Barbados readily provided with Novocaine whilst on duty. I don't know if Ms. Williams would wish to address that.
Thank you for that question, and the answer is yes. They are provided with Narcan nasal spray. Yeah.
Thank you very much. And as you rightfully said, Narcan. I know the question spoke to the correct substance is Narcan. Thank you, Mrs. Williams. So there being no other questions at this time, it is always fitting to give thanks. And we are grateful, certainly, to all present and those online for staying the course with us for today's presentation. And therefore, in his other capacity, he's very multifaceted. You see, all of our people are multifaceted here at the NCSA. And in his other capacity, as the chair of the Projects Outreach and Fundraising Committee with the NCSA Board of Directors, it is indeed another a privilege to have Dr. Ronald Chase move the closing remarks. Dr. Chase.
I get to stand on high again. It has been a good afternoon, yes? I would first like to thank everyone present in person and virtually for attending as we share this report on the drug situation in Barbados for 2022. We would like to thank you, our participants, our stakeholders, our partners in Barden, who took the effort and time to compile and submit the requested data and information necessary to compile this report. This report would not be possible without you. And we thank you. We look forward to our continued partnership for 2023, 2024, 2025, 2026. You get the idea. At this time, I will take a few quick moments to make mention of a few key points that we would like you to take home today. Less women, as we heard, may be presenting for treatment, but this may not be the actuality. We heard Ms. Foster mention and speak about the barriers to treatment study that the NCSA would have recently published and released late last year. So I invite all of you to Google barriers to substance use treatment, factors hindering women's use of treatment services in Barbados, and take a reading of it. We heard words such as rehabilitation, treatment, but really the words should be recovery, restoration, reintegration. An important factor of restoration, recovery, and reintegration is a job, is employment. It not only would build self-esteem, but when you don't got money, you're stressed. And when you're stressed, you tend to rely on substances that you think will relieve that stress. So yes, we would like persons to reduce their harm of using drugs. We like them to not use and abuse drugs. However, if they're still unemployed, if they're still trying to find how they're going to feed themselves and their families, you have a lot of talk. So therefore, I do encourage all of those listening now and hopefully on recording later, if the opportunity arises for you to assist someone who is recovering from drug use to get gainful employment, do not be biased by their past. Okay? We spoke a lot, we had questions about workplace drug policies. Strong policies can be beneficial to any of the employees or employer within a company or institution that may be struggling with substance use. As our manager said, it is not about identifying and pointing fingers as to who may have a drug problem, but having a avenue, an opportunity, access to access treatment. If you determine that you recognize that you have a problem, or it is realized by your attendance or something at work that you may have a substance use, that there is a pathway and a protocol to not only get help or offer help, but also do that in a respectful and confidential manner. A strong workplace drug policy will not be strong unless everyone within that workplace has a voice as to what they want within this policy. So obviously, in the development of persons' workplace policies, we encourage the involvement of all levels of employees. If you want to know how important it is, or how many places have a workplace policy, drug policy, or even if people are aware if their institution has one. There's another recent publication from the NCSA where there was a workplace-based survey that was also recently published late last year. The Bardeen report is not meant to be historical collection of data, but a tool used to monitor Barbados' efforts against substance use and indicate where our efforts need to be directed in the upcoming year. The trends seen through the years will show us and give us hope. Now, although the drug landscape is changing, we will be rising, and we have risen, to meet the challenges. So let us continue to do so. On that note, thank you, ladies and gentlemen, for your attention, for your attendance, and have a pleasant and blessed evening.
And thank you graciously, Dr. Chase. This is your moderator, Ms. Paula Atkinson, urging you to continue to support the efforts of the National Council on Substance Abuse throughout the year 2024 as the NCSA continues to strengthen prevention. Good day.